All right, welcome to the Hope for Med podcast. I'm your host, Dr. JB, and today's featured guest is Dr. Jade Norris. She is a board-certified family medicine physician and a wellness coach living in Las Vegas, Nevada. Welcome, Dr. Norris.
Thank you so much for having me.
So to begin with, I see that you have a bundle of joy with you. Tell me, so you're a new mom?
Thank you. Yes. This is Aaliyah, my baby. She's 2 weeks old. This is my second daughter. So she is going to be featured with us today.
Wow, congratulations.
Thank you so much.
So 2 weeks, and here we are doing a podcast. Man, that's
amazing. We just keep on going.
That's absolutely amazing. So to begin with, please share your story. What made you decide to go into medicine in the first place?
Yes. So I was one of those children who always said they wanted to be a doctor when they grew up. And so around 4 years old, when you have to dress up for career day, I dressed up as a doctor, said I wanted to be a doctor. I was a weird kid who was obsessed with my pediatrician's office, loved watching him give me shots. It was very strange, would ask him a million questions. And, the interest just continued to grow from there. And of course, in high school and undergrad, I began shadowing physicians and really seeing what the career entailed, and my interest and passion for it continued to grow as I grew. And so that foundation was laid as a child, that desire to help and the interest in science and the body.
Awesome. So, since the age of 4, you said, I'm going to be a doctor, and here we are. No bumps along the road.
Oh, lots of bumps along the road, for sure. Well, I would say that, high school was very smooth for me. I graduated kind of top of my class there. It wasn't really until undergrad where I started having challenges academically, and just being challenged. I learned that although I was at the top of my class in Las Vegas, once I hit undergrad and it was kind of just the 3 exams and you average it and that's your grade, I realized that my standardized test taking skills really needed some work. And so that was really where challenges in that area began. And, had to push through that in many different areas throughout medical training and, to get to the end of the road.
Wow. Yeah. Standardized testing is, definitely something that gives a lot of people struggles. And, the unfortunate reality of it is we have so many standardized tests we have to take along the way before we finally become board certified.
Absolutely. Yeah. And it's just a skill that, now that I'm a mom, I'm going to be, asking my daughter questions and being like, is it A, B, C, or D? Like really trying to instill those skills early because they were just skills I hadn't acquired early on.
Mm-hmm. And so how did the struggles with standardized testing affect you and your goals of becoming a physician?
I think the main thing that was challenging is that many of my advisors along the way kind of tried to advise me out of medicine because test taking was a challenge. Mm-hmm. And, to have people that are whose job is to guide your career, tell you, if you can't take standardized tests well, you won't be able to be a doctor, because you have step 1, step 2, step 3, boards, this, that. And so I think that was the challenge, is people that were supposed to help guide me and through the finish line were actually encouraging me to look at other careers outside of medicine because of that challenge. And so I had to really, I'm a woman of faith. So I had to really depend on God and my faith and my family and, just that willpower inside of myself to tell myself that, no, I can make it through this. I can figure out this challenge. It's going to be hard and that's okay. But that was the most challenging part, is continuously being told, think about something else. Well, there's other careers in medicine. You don't have to be a doctor.
Mm-hmm, mm-hmm, mm-hmm. Well, getting that inner courage to just keep, at it, despite everybody else telling you, no, it's not possible, is really amazing. Even with family, I think faith definitely played a big role in really allowing you or helping you maintain that courage and that focus. And so I definitely applaud you for that.
Thank you. I mean, I don't take credit. I definitely, did all I could do in my own strength, but I 100% say that it was God that brought me through, for sure.
Hmm. For a reason. For a reason.
Absolutely. Now I'm like here to encourage anybody else who is having trouble or struggling. I'm like, you can do it. You don't have to have a traditional path. You don't have to look and test and do all the things just like everyone else. There's a path for everybody to make it through this.
Hmm. So then you got into medical school. And how
Yes.
was
So, the story of getting into medical school was interesting. So, again, when I was in undergrad and took the MCAT, I didn't score well on the MCAT. And so I started looking into alternative ways to get into medical school if you didn't do well on the MCAT. And a friend of mine who was a year ahead of me, had went to a medical post-baccalaureate program. I had never heard of those type of programs before. And so she told me, look into medical post-bacs. And so that's what I did. And I started researching those. And I came across one in particular that kept getting these high reviews and student testimonials that were now physicians or either in medical school saying how amazing this specific program was.
it? Hmm.
It was called MedPrep, and it
The
was in
med prep?
yeah, MedPrep,
Okay.
and it was in a town I had never heard of. It was in Carbondale, Illinois, of all places, and so I was like, okay, how far is that from Chicago? I'm just like, where is that in the vicinity? It's not close to Chicago. It's in the middle of nowhere in Illinois. And so I was like, okay, I'll give it a try. I'll interview. I'll apply. And when I went there, I just felt God say, this is where you're supposed to be. And I was, I'm from Las Vegas. I'm like a city girl, very diverse, and out here, melting pot out here, and it was very rural, small town. But the program was phenomenal for me. It was what I needed. And it was a program that helps you it's like an intensive MCAT study program that helps you to prepare to matriculate to medical school. So that's what I did. I went to that program. It was basically like a MCAT boot camp. You woke up, you studied. I mean, it was intense, but it was amazing because you had this cohort of people all doing the same thing in this small program. And so we really were like each other's ride or die through this program. And then, so that gained me my matriculation. I was able to retake the MCAT after that program and gain entrance into medical school. Uh, and I was blessed with a full ride scholarship at that to medical school. So
Nice.
it all worked out the way it was supposed to work out, although it didn't look the way I thought it would look. That program was a 2-year program, so that was an extra 2-year sacrifice. But it was worth it in the end. That was worth it. But 2 years sounded like a long time at that time. So that's what I did. So med school, that's how I got into med school, and med prep was an amazing experience as I look back on it, and is what I needed at that time.
I mean, that's amazing because after you did that, you got a full ride to med school, 4 years
Yes.
covered.
Yes. And the thing about that is it was, again, I wanted to be in med school in California. That was always my dream,
Mhm.
was to go to California for med school. And when I did not get accepted to med schools in California, I was devastated. And I tell the story of applying to 20 medical schools and getting one acceptance letter, and just having that devastation of going to the mailbox 19 times and opening up rejection letters. And I got that one acceptance letter.
Mhm.
And a month later, I got the full ride scholarship letter to that one
Wow.
medical school. So
Wow.
again, I just say it's God. And I'm like, okay. And then what's even more amazing is my dream of going to residency, or my dream of going to training in California, actually happened in residency. I trained in Loma Linda in Southern California for residency. So it all works out. But it looks different than I imagined it would look. It wasn't as easy as I thought, that I hoped it would be, but I can look back and say it was a beautiful journey. And now I just appreciate being in this position so much more.
And when did you graduate from residency?
I graduated from residency in September of last year. So we're now in 2022. So September of 2021. Typically you graduate in July.
Mhm.
But I did what people said, you shouldn't do, which is had a baby during intern year of residency. And so the maternity leave gets tacked on the end of your training. So I finished September 2021 and opening my own medical practice straight from residency, which opens next month. So pretty
Wow.
exciting.
Well, we need to take some pause and say congratulations.
Thank you.
Congratulations on being a new grad. This journey was tough, but you made it, to the other side. And now you're going to be, experiencing this whole new different world.
Yes, absolutely. I'm excited. Thank you.
So if we go back in time, so you got into residency, it really just takes one. I mean, you can't go to 20 different medical schools, right?
Right.
It's just one that you need to get accepted, and then you can become an MD.
That's right.
And so during medical school, what was that experience like for you?
That experience was a culture shock. that would be the
Another
main.
culture shock.
Yes, a major culture shock. It was, more years, 4 years in a rural city. And again, growing up in Las Vegas, very diverse melting pot type of city. It was my first time being around some people that told me I was the first Black person they'd ever been around, and being asked questions that reflected that new experience for them. And it was challenging. It was isolating many times culturally. And I'd say that was even more challenging than just getting through medical school's curriculum, was the cultural isolation that I experienced in the rural city and with my classmates that were not welcoming.
Mm. Did that post-bac program at all prepare you for this experience? Because you did it in a rural area then also.
It didn't, because the post-bac program was actually specifically for um, students of underrepresented minority backgrounds.
Got it.
So it was predominantly African American or Black and Hispanic students within that program. So it was kind of like going to a HBCU, the post-bac, and then it was like the total opposite. And it wasn't so much that, you're used to being a minority in settings of, science and STEM, right? Undergrad, even in my undergrad in Las Vegas, I was in classrooms where I was typically one of few people of color in the classroom. So it wasn't so much that. It was more so the culture and the cultural isolation, in addition to being one of the only or few. So if that makes sense.
Yeah. No, I get it completely.
Yeah.
So when you started medical school, I know that you said that at the age of 4, you're interested in a career in medicine because of your pediatrician, that you enjoyed that. So did you go in thinking you were going to do family medicine, or how did you end up deciding that?
No, that's funny. So, growing up, my family jokes and says that I said about every doctor type that I could think of throughout my years. I went from saying I wanted to be a foot doctor to a baby doctor to a pediatrician to so every month it was a different type of doctor I wanted to be as a kid. However, when I went into medical school, I had done a lot of shadowing with OBGYNs. I had a OBGYN who I actually would use as, now I know that I was using her as my primary doctor. So I didn't have a family medicine doctor growing up. I either went to my OBGYN and I would use her kind of like as my well woman annual exam, basically like a primary care doctor. And if I had any urgent needs, my family would just go to the urgent care. So I never had a family medicine doctor. And so I wasn't familiar with what a family medicine doctor was prior to going into medical school. And then my OBGYN had her own private practice and she let me shadow her. So that was my experience, was kind of outpatient OB-GYN. And so that's what I thought I wanted to do. And then I became a labor and delivery volunteer in undergrad. And that gave me more exposure specifically to the women's health and mostly to outpatient women's health. And so that's what I thought OB-GYN was. And so I went into medical school saying I wanted to be an OB-GYN. Now, once my OB-GYN rotation hit third year, it was actually one of my first rotations. And that was my first experience to see how surgery heavy OB-GYN truly is. I was like, oh, it's not just outpatient in the clinic, seeing women and talking about contraception. That was kind of more of my experience in shadowing, or just popping up to deliver the baby, not doing the labor management or, oh, now it's become a C-section and now we're going to do gyne surgical procedures. So once I saw the full scope of what an OB-GYN actually does and that it's really predominantly surgery, I realized I'm not interested in surgery. I really love the clinic. I love talking about women's health, but I love small, short procedures like in the clinic. And what I learned is family medicine is really what I love to do. And once I had my family medicine rotation, I was like, oh, okay, this is what I like to do. I just didn't know what this specialty was. So I learned about that once I was in residency on my third year rotations.
Got it. And so with the family medicine, do you intend to also deliver babies?
No, I surely don't. I enjoyed that aspect of my training and residency. However, part of my reason for starting my own practice is really to have work-life balance for myself and for my patients as well. And so, no, I love women's health and I love counseling women, motivating women, especially when it comes to wellness and their own balance in life. But no, I will not do any obstetrics or surgical gynecology. I'll partner with our local OB-GYNs for that.
Okay. To allow you to have better control over your schedule.
Absolutely.
So, I think it's so amazing that you just graduated from residency, but you're already, thinking about, how can I create a life for myself that allows me to have some balance? So,
Absolutely.
and you talk about wellness. So when did this whole concept or emphasis on wellness get planted in you?
Yes. So really, when it comes to wellness, it was something that was always a part of the lifestyle with my family, with my grandmother and my mother who raised me. I really saw these women who put their wellness first. I remember being a little girl, and when I would go to my grandmother's house, we would always go on walks. She'd say, "Okay, put on your shoes. We're going to the park. We're going for a long walk," or we would do Taekwondo together. That was our thing. If people, I'm probably dating myself, if people remember what Taekwondo was, these workout videos. So that was what I do. Or I remember being in the back of a workout room, group fitness room, watching my mom do her fitness. And then, after she's making us salad and blending us smoothies and we're doing that together. So all of that was just a part of how I grew up. And then once I went out on my own for undergrad and med school, that was an essential part of me, keeping myself together for studies was having that stress reduction through exercise and having that quality time to rejuvenate myself through getting into things like juicing and healthy cooking. Like all of those things really became hobbies of mine, or, signing up for 5Ks and 10Ks and kind of training for those. Those were just fun things that helped to keep my stress levels low
Mhm.
while training. It helped to keep me well. And then, I would have people ask me about it, like, "Oh, you're into juicing? Tell me more about juicing." Or, "Oh, you cook healthy recipes? Tell me more about that." And I realized that was something women started coming to me asking me about, was just the wellness things that I was already doing on my own and researching on my own for my own mental health, right? And that was kind of where the coaching aspect was born. And in med school, I one night I decided to host like a spa night for all the ladies in my program, and it became an annual thing. Women, the girls were like, "When is the next spa night?" And so I was like, "Okay, this is kind of like my thing, is promoting wellness and balance." And so it became another passion, and it's a beautiful adjunct to family medicine and primary care, because that mental health and wellness is such a major component of all the other aspects, when it comes to diabetes, hypertension, obesity, all the other things we're trying to really monitor and prevent in primary care and family medicine.
So, having gone through these experiences and this background in wellness, when you were going through your training, medical school and residency, did you experience burnout yourself or know of anybody who did?
Uh, Absolutely. My problem in medical school was I didn't know how to take a break. And I had to learn the importance of, it's not beneficial to stay at the library from 6 a.m. to 9:30 p.m. And just, it's not the number of hours you're studying, it's the quality of time within the study sessions you're having. So it wasn't really until I met my husband, and at the time he was my boyfriend and fiance, where he was like, it's actually counterproductive the way you're studying. You're going nonstop, you don't take breaks, and he helped me to realize, okay, let me study for a power hour and get out of the library and take a break, and then come back and do 2 more power hours with a timer set, and then leave and take a break. And I had to learn how to do that in medical school, because I would just, basically pack my life for the day, like a tent, and just camp out in the library from sun up to sundown until I was passed out. And it was terrible balance, and it wasn't doing what I was hoping it would do when it came to reflecting in my scores, right? So that was more with med school. And then with residency, I definitely knew how to balance more. It just looked different in that season, because now I was married and then I had a baby. And so it was more so setting boundaries with things like, okay, I will not bring any work home. When I go to clinic, I will finish all my notes at clinic. And then when I come home, I will take no notes home. And that's kind of reflecting in how I'm maneuvering in this season post residency, is that balance. And those, when my daughter's at daycare, I grind during the day, and then when I pick her up from daycare, she doesn't see me on the phone, there's no work, just so that she gets my full attention when on weekends and evenings. So each stage of life looks a little different, and how I had to set boundaries, healthy boundaries for myself, but you continue to make those boundaries as you go.
Mhm. It's interesting that you mentioned boundaries, because oftentimes, when you're going through training or when you're working in healthcare, it's sometimes discouraged
Oh
to
yeah.
set these boundaries, right? It says, people will say, you are limiting your growth. You're supposed to be the yes person, the yes man, yes, sir, yes, ma'am. So, how did you, um, how did you decide that it was really important to go ahead and set boundaries?
Yes, it definitely is discouraged. And I learned pretty early on in my training in residencies, especially, that no is a complete sentence, and no is also, it's a healthy thing, because when you're saying no to something that is, not the right fit for you, you're saying yes to other things that will be the right fit for you. So, you know, even when it comes to things like signing up for committees, or getting on projects with attendings, or all these extra things you can do, I learned to say, oh no, no, thank you so much for considering me for that, but no, I won't be able to do that at this time. I'm really using my extra time to spend time with my daughter at this time. And that can be frowned upon if they prefer that, but for me, um, you have to set those type of boundaries for yourself if you want to be able to properly feed not only yourself, feed into yourself. I like to use the common cliche term that you can't pour into others from an empty cup. So I fill my cup and I serve others from the overflow. But trying to serve people from an empty cup, it just doesn't work. That's when you really will feel the burnout.
I think, one of the things that I'm hearing you say is first you had to figure out what your priorities were.
Absolutely. Yes. And that was the thing. Growing up, I said, I want to be a wife, I want to be a mom, I want to be a doctor, I want to own my own practice, I want to have my own business. I used to say these things, and people would be like, "Whoa, you need to choose one, because you can't be a doctor and be a mom and be a wife and be a business owner. You can't do all of that." And that's not true. But you do have to figure out how to make that work. And I can't do it all at the same capacity. I have to create those healthy boundaries so that I can really feed all those aspects that I'm called to do.
Hmm. Hmm. But your priorities may be different than somebody else's priorities, right? So, but the step one is always to know what are your individual priorities, and
Yes,
then take action in alignment with your specific priorities,
that's right.
and be very connected with yourself to know when you are overstretching yourself and when you need to say no, right? But you have
Yes.
to, keep in mind, what are your individual priorities?
Yep. And being flexible and knowing that we continue to evolve, so the way that looks today may look different in 6 months, and to continue to reevaluate those priorities and how to implement them for your ultimate, happiness.
Mhm. So going back to when you were an intern is when you had your baby, your little girl, correct?
Yes. Yes.
I can't even imagine what that was like. I had my first child when I was in my third year of residency. So I also had one in residency too. Intern year and third years is different, right? It's miles apart. I went to a 4-year program. So what was that like being a intern and a new mom?
It's so funny because I look through my medical journey, and everything seems so much easier once you're done with it. Like it's some sort of blur that happens. And so when I try to reflect back, I'm like, I know it was super difficult. However, for some reason, I just don't remember, the struggle that much. And so it's just one of those things where you just put your head down and you just do it. I remember, sometimes having to run off and go vomit and then rejoin rounds like nothing happened. Or I would walk into a patient's room and I would smell their chicken that they were eating, and I just like let my team know, like, hey, if I disappear for a second, it's because I got sick, but I'll be back. And I would like leave and come back. And so, you know, you just do it. So I don't really remember. I remember when I was really big, the last few weeks I would have to grab chairs a lot and just sit on rounds, and my team would look out for me. They'd be like, "Hey, Jay, grab the chair during this part. We're going to be in this, this unit for the next 20 minutes." So you just do it. And so that's really the summary of what I remember from having her intern year. I know it was difficult. I know it was a challenge, but I just kind of took it one day at a time until it was time to have her. Now, I will say that I was blessed with a very healthy pregnancy, and I was able to work up until I gave birth to her. And, I had no complications. So all of that was a huge blessing and made my experience as seamless as it could be.
Mhm, mhm, mhm. The same can be said about pregnancy in general, right? After you have the baby. So what was it like? You're like the further away from the actual experience, the less painful, the experience is. Oh, I was just my bundle of joy, and you forget
Right.
how
Right.
painful it was. So yeah.
Absolutely.
So now that you've graduated, tell me more about what your next steps are, what your plans are.
Yes, so my next plans are opening my own medical practice, Inspire Primary Care. We actually open in 3 weeks on February 1st. Yeah, and so that is, it's a direct primary care membership practice. And so that is super exciting. I feel like I basically am birthing two babies here, my, my newborn and my new business. And so that's very exciting. I will be working some urgent care on the side as we, ramp up our patient panel for our medical practice. So those two things I'll be doing, in addition to wellness coaching on the side, and I have some speaking engagements, things like that I do. We have children's books. We have a third children's book coming out, and so it's a lot going on. But again, I'm just kind of taking each day one step at a time with each little checklist each day, and it's slowly coming together.
So, question for you. So, you're just graduating and you're going straight into direct primary care. What made you make that decision?
Yes. So again, growing up, the doctors that I most admired had their own private practices. So my pediatrician growing up, he was a one doctor solo pediatrician in his own private practice. And then my OBGYN, who I used to shadow in undergrad, she was a solo physician, OBGYN in her own private practice. So that was kind of my exposure to being a doctor growing up. And that was my dream was, oh, I want to have my own practice and kind of be the solo doc and community doctor who's like known for health and wellness. And that was just like the picture in my mind, right? And when I got to medical school, it was very discouraged as far as, oh, having private practices is a thing of the past. The hospital systems bought up all the practices. You can't have your own practice anymore. That was basically what I was taught in medical school. And so I kind of, let that dream go and said, okay, I guess the only way you can be a doctor is to become an employed physician after you're done with training. And then during residency, though, one of my advisors was just, kind of having some conversation with me over lunch. And she was saying, well, what's your dream? What do you envision yourself doing? What would you love your job to look like? And I was kind of explaining it to her. I was like, man, I always dreamed of being like this solo doc in my own clinic and, being known in the community as the community physician and promoting wellness and having the freedom to come and go. And I really want to be able to text my patients. I really want them to just be able to like call me up. And I was like, but I guess none of that's possible. And she was like, well, it sounds like you want to do direct primary care. And I'd never heard of that. And I was like, well, what is that? And so from there, she just like planted this seed. And I went and like binged all the direct primary care content. I mean, I went and bought the books on what direct primary care is. And I looked at YouTube videos, which YouTube had a lot of like old conferences on direct primary care. And I looked at all of those. And then with COVID, it was a blessing for me as a resident because all of the conferences, national conferences, were virtual, and it was actually free for residents to attend. So it was perfect. So then I was able to attend all of the major direct primary care conferences virtually for free as a resident. And I just was able to soak up all of this knowledge. And then during these conferences, I was able to come across several physicians who had started their direct primary care practice straight from residency. And I reached out to them and they became my mentors. One of them had a mastermind conference at his practice in Detroit. So I went and attended that. And again, he has a very successful practice that he developed straight from residency. So I just said, well, then if it's being done and they did it, then I can do it. And so that's kind of how the whole thing was birthed. And I'm so thankful for that one conversation from that mentor because now I know I'm doing what I dreamed of doing.
Yeah. And you're going along your mission in terms of, this non-traditional path, but creating this amazing, end product. So I'm very excited for you and what the future holds.
Thank you so much.
So, with that being said, if my listener or the audience wanted to get in touch with you and find out more about what you're doing, how could they do so?
Sure. So I'm on Instagram quite a bit at Dr. Jade MD, DrJadeMD. And we also have our website, drjademd.com. And drjademd.com and Dr. Jade MD on Instagram are really like my hubs that connect everything else. So for Inspire Primary Care, if you're in the Las Vegas community, that's where our practice is. And so that's inspireprimarycare.com with a N. It doesn't start with the I. So NSPIRE, primarycare.com. And again, all of those hubs are connected on my Dr. Jade MD. Same thing with our children's books. You Can Call Me Queen and You Can Call Me King are our empowerment children's book series. Mm-hmm. And those are also connected through Dr. Jade MD.
Awesome. And lastly, do you have any last minute words of wisdom for my audience?
Yes, I mean, especially I imagine that your audience is filled with, dreamers and, go-getters in whatever their passions of medicine or health would be. And so I would just tell them that they can do whatever it is that they dream of doing, and they can do it their way. It doesn't have to look like everyone else's path. It can be a non-traditional path. You can create your own path and do something that's never been done. And to just believe in whatever dream you see in your mind and stick to it, and you can do it. And that's really what I would want to leave with them, is that whatever life you really dream of having, just keep going for it, regardless of who else sees that vision and that dream.
This is hope for new day for for us, by us, and just for us. This is hope for med.